My name is Frankie Walls, and I'm a PA here at the ENT Institute. I provide all services from sinus infections, allergic rhinitis, acid reflux, foreign bodies in the ears, ear pain, pretty much any ENT need that you have. The main reason I enjoy working at the ENT Institute is that this workplace really feels like a family, and I've never worked with a company where I feel like we really and truly care about our patients and we make their concern our number one concern. Having a relationship with patients is probably the most important thing to me as being a healthcare provider, and just always treating them like family. I treat my patients the way I would treat my sister, my cousin, my mom. We have so many different departments throughout the Ear, Nose, and Throat Institute. We have the sleep department, which we have a respiratory therapist that leads. She really helps get people sleep studies, sleep apnea, CPAP machines when they need it. We have physical therapy. They treat dizziness. We also have a great allergy department. As a company, we have different departments that come together, and that's what really makes our company great. So the way I help people with their ear, nose, and throat concerns, it's very dependent and specific to each person. The number one thing I try to do is just really listen. A lot of people just want you to listen, and then once we get to the bottom of it, I try to fix it. The one thing I wish people knew more about and there was more awareness is untreated acid reflux can actually turn into something called Barrett's esophagus, which is a precancerous condition. If you catch acid reflux quick, you can do a lot of lifestyle modifications that prevent you from having cancer. So scheduling an appointment is pretty easy. You can do them online, you can call, schedule an appointment, depending on how busy I am. Sometimes I tell patients just come to the clinic, and if I have an open, I'll try to squeeze you in. As a PA that actually worked in urgent care prior to working in a specialty, urgent care just does not have the supplies or the resources that a specialty clinic has. So just come to the specialist before going to urgent care. Probably one of my favorite patients, she woke up in the middle of the night with something crawling into her ear, went to the ER freaking out. It was a cockroach. So this is about 2 in the morning. She's in the emergency room. They can't get the cockroach out. She's going crazy. They tried their best, couldn't get it, told her to follow up with ear, nose, and throat. She was at our clinic at 8:30 in the morning waiting for us to open, brought her back, got the cockroach out. Her eardrum looked beautiful. It wasn't ruptured, luckily. And she hugged me and probably cried about 5 times telling me thank you. Outside of the office, I am a runner. I used to run a lot of half marathons. Now I'm more 10K, 15K. I went to school at UT in Memphis, so I try to run the St. Jude 10K every year to raise awareness for cancer and just to get outside and exercise. I also enjoy hiking, spending time with my dog and my husband, and then probably drinking lots of coffee. I wanted to be a PA because I love ears, nose, and throat. I love foreign bodies in the ears, which sounds crazy, but I live for taking something out of someone's ear. And I really like to help special needs patients. A lot of patients that struggle with hearing loss are special needs, and I have a very warm place in my heart for special needs patients, so I feel like I can really help people at the Ear, Nose, and Throat Institute with that, and I just love being a PA.